3, 2, 1.
Hi, I'm Dr. Joseph Jimenez. I'm one of the physicians and co-founders of Performance Spine and Sports Medicine. Today, I want to talk about lazy butt syndrome. But before we get into my presentation, I just want to show you the overall picture and flow of the presentation. I want to talk about lazy butt syndrome, how to cure it, but with the specific purpose of having a healthy back. And the reason being is if you find a cure for lazy butt syndrome, you would actually prevent low back pain. And so we're going to get started. Lazy butt syndrome is not a physician's term, it's more of a layman's term. I hear it mostly with personal trainers and athletic trainers to describe a very specific thing that goes on in the body. So what is lazy butt syndrome? Well, as I have here on the slide, it's simply weak glute muscles. And I also add in the fact that you can have weak core alongside with it. In fact, it's so common that you'll find both to have a patient or an athlete to have both lazy butt syndrome where it has a weak buttock muscles as well as weak core muscles. And a lot of this talk is actually a continuation of the blog that I created for high heels. And I use this slide to illustrate one important aspect. For all those women out there that want to wear heels and prevent back pain, and I'm sure there's a lot of back issues using high heels, it's very important to realize that strong glute muscles or strong buttock muscles actually help prevent back pain, especially if you're going to be wearing high heels on a daily basis. As this diagram illustrates, the one thing that I want to focus on as it relates to the talk is what heels actually do to your body. When a woman wears high heels, as the purple arrows show, it does two things. First thing, it actually accentuates the buttocks, so it curves it out much more to the backside. As a consequence, the second thing that happens is it tends to curve the hip inward. And that's very important because what happens is in this position, the hip becomes tight in the front and the buttock becomes weak on the backside if your hip is in this orientation. And high heels promote this exact positioning. So because of that, you need to fight this urge for the high heels to do this exact thing to the hips. There are other things that happen. Of course, the chest becomes more prominent, knees are bent forward. Okay, so that's also another important concept, but I want to focus mainly at the hips and buttock area. So step one, you need to stretch the hip. I told you that high heels tend to curve the hip a certain way. And in order to counterbalance this, you want to stretch the hip. And here are some very important exercises. There's the side-lying hip stretch, where you simply lie on your side and you pull on your foot like so. And I'd love to have this stretch be done on and hold that position for about 5 seconds. So if you can count 1 Mississippi, 2 Mississippi, 3, and so on, for at least 10 reps or so. Another very important hip stretch is this position. It's a kneeling forward hip stretch. And you need something to basically cushion your knee while you're actually standing over it. And you're going to simply thrust your body forward and hold that stretch for, again, 5 Mississippis for about 10 reps. The next thing that's very important is to learn how to brace. And for physicians and therapists, we've found out that bracing on a daily basis actually prevents back pain, especially if you've had back pain in the past. And so I have a picture here of a simple position on your back to practice bracing. And bracing is very important. And really what I want to emphasize is the first step is when you lie down, flatten your back, and you're going to perform a Kegel. That is, contract the pelvic muscle such that you are trying to hold your urine. Okay, so it's that kind of maneuver that you want to hold. In addition to that, I want you to contract your abdominals. Kind of pretend you're bracing your abdominals as if a bowling ball is about to fall on this young lady right now. So as she's lying there, picture yourself lying there as well. And imagine I take a heavy bowling ball and I drop it down to your abdomen. What do you tend to do? Just as a reflex response, you're going to hold your abdominals very tight to brace your abdomen. And I want you to hold that position for, again, a count of 5 Mississippis. If you can master this technique, along with Kegel exercises, you'll absolutely prevent back pain based on some of the recent studies that we've shown in the last few years. And then finally, step 3 to having a healthy back and preventing back injury is to have a buttock exercise program. And in this talk, I'm going to introduce a very basic glute medius program, glute maximus program to strengthen your buttocks. So the first thing is the one-legged squat. And there's many variations of this. In this picture, I have one of the legs pretty much propped up on the bench, and I want you to squat down in a very controlled posture. The sets and reps are very simple. If you can start off with just one set for each leg for about 10 reps, it's very important to start at a very comfortable weight. It's preferable if you had a trainer or a therapist guide you through the specific movement to make sure you're not doing it too fast or putting yourself in danger. It's also important to note that before you start any exercise program, please consult your physician, and preferably the physicians at PSSM as well as our therapists. The other very important basic exercise to master is the reverse step up. And there's many different ways to do this. I have the picture here on a bench, but you can obviously start on a flat surface or floor. And you're simply going to bend your hip forward and then go back to start position. It's very simple, but actually it's very difficult to master. And again, one set of 10 reps is all you need to start. If you can progress and add in 2 or 3 sets for 10 reps, that's also a great start. And finally, lunges. The beginner program wouldn't be perfect without having some sort of lunge exercise. And many women are familiar with this exercise. You don't need, to begin with, you don't need dumbbells to start. You can have no weight whatsoever, and you're going to simply step forward, and you're lunging forward. And that's the main crux of this particular exercise. There are other variations. This is a step up where one of your legs is stepping forward and the other leg is stepped down, and you're simply going to step the lower leg up into a 90-degree position. 90 degrees meaning the knee in relation to your upper body. So these are some of the basic exercises you can do. Honestly, with minimal equipment, if you have some of these equipment such as a dumbbell or a raised platform, the same height as a regular step, you can use. If you have steps in your basement, you can do this exercise there as well. And these are some of the things that we talk about in terms of the beginner buttock program or glute maximus program. Overall, I want to progress toward a more advanced program, and that's what future talks are going to be about. And again, the goal here is to have a healthy back, and hopefully you've learned something. Increasing the strength in your glutes, stretching your hips, mastering the abdominal bracing, all help you have a healthy back, prevent back injury, and allow women out there to wear high heels effectively. Thank you.